Hi, my name is Dr. Kamal Aderibigbe. I'm an orthopedic trauma surgeon with Iowa Orthopedics and MercyOne in Des Moines, Iowa. The anterior hip replacement is a less invasive approach to doing hip replacement surgery. It's basically coming in between two muscle planes without cutting or sacrificing muscle. It certainly allows for a quicker recovery, better component placement, and improved functional outcome after hip replacement surgery. So the advantages of an anterior approach basically allows patient quicker recovery, improved mobility, less restrictions. Most importantly, pain after recovery is less, and patients do not require physical therapy for the majority of the patients. Usually, most patients that require hip replacement surgery will be a suitable candidate for an anterior hip replacement. In my practice, virtually as much as 95% of the patients will be a good candidate. There are a few requirements that we tend to make sure that patients can satisfy, and the most important is basically having good hygiene around the anterior portion of the hip and not having any excess skin condition in that region. But most importantly, based on how we can place the incision, virtually just about most patients can qualify for this approach. So recovery after surgery should be anywhere from 3 to 6 weeks. On the faster route will be 3 weeks, and most patients will be fully recovered by 6 weeks. For patients that require return to function a lot quicker, we can get those patients back to work as long as they're not doing any heavy activity at work by week 3. For patients who do more intense activities at work or just in their routine daily living, we can anticipate anywhere from 4 to 6 weeks. For most patients, physical therapy is not required. Majority of the patient will be up and moving right away. Walking is the most important therapy patients can do. Getting up, moving around multiple times an hour, up to a mile a day will be what I'll consider normal post-surgery requirements. But in certain subsets of patients who for other ailments require physical therapy, we can entertain that, but certainly 95% of our patients will not require any formal physical therapy. With the technology we have today, we can anticipate this replacements lasting anywhere from 25 to 35 years without any unforeseen complications. Patients experiencing growing pain and pain that affects their quality of life should talk to their primary care providers or even their orthopedic surgeons about the possibility of needing hip evaluation. Most patients who struggle with anterior hip pain, difficulty wearing socks, putting shoes on, getting in and out of a car, going up and down stairs should be well concerned about possibility of arthritis of the hip, and such patient should certainly seek further medical evaluation, to include discussing this with their primary care providers or with their orthopedic doctors.